Business Analytics chapter. I'm Christopher Chan. I'm a quantitative strategist with GIC and a committee member of the BA chapter of SES. I will be your facilitator and moderator for this particular session. So before I begin, I would like to make a few announcements. Firstly, we would like to inform you that the full event will be recorded in real time. We may publish the event recording in whole or in part on SES website and on social media. Now, during the course of the event, if you have any questions for the speakers, you can click on the Q&A button that you can find in your Zoom session below. There's an icon there called Q&A to submit your questions. Now, from the agenda, the way we're going to carry out this is that the Q&A will be actually reserved all the way to the back where all the speakers have actually spoken. Then we'll actually conduct the Q&A session. Lastly, at the end of the event, we will actually provide a QR code to solicit your feedback so that we can improve conducting such a session in future. So now I would just like to invite Manik, our president of the BA chapter and the CEO of Vulcan AI, to actually deliver his opening address. Mr. Manik, please.
Thank you, Chris, and good afternoon, everybody. And it's a Friday, so thank God it's Friday. I mean, we typically do this in person. I think last 5-6 years, we used the ITIS session to also connect physically, but these are new times, unprecedented times. And instead of saying, let's not continue these sessions, we also adapted to the new normal, and we're doing it through Zoom. And I'm actually quite pleased to announce that actually nearly 400 people signed up. And I think more and more people will be joining online as the session proceeds. I mean, COVID-19 has affected us in many different ways. When we think about our families, I mean, the way we are socializing with families is a bit different these days. At work, it's different. We have to work from home mostly. We can't travel. So it has affected all of us in many different ways, economically and from a health perspective. But some things which we do at a personal level in our day-to-day lives, I think from a government perspective and from a country level, they're very interesting insights. For instance, how do we keep track of people who are getting infected? How do we make sure it doesn't spread? And how do we get insights in terms of what the hotspots are? How do we contain the spread of COVID-19? So keeping the country safe, and it's through regulations, but there is also a great part which analytics play in it to stay on top of the situation and take the right corrective action. So to cover that aspect, we actually have Dr. Go and Dr. Liu from MOH, CGH, and Sing Health, who will be sharing a little bit about how they're using healthcare insights to fight COVID-19. Then as we move more towards, I guess, containment and safe distancing at a local level. And what I mean by that is companies and facilities and how do they keep their own employees and staff safe going into the future when slowly businesses start reopening and people start coming back to work. What technologies and what AI can be put in your own office so that it makes people feel safer? And can you do more expedited automated contact tracing so that if you have, say, 1,000 people working in your office and you have you're unfortunate to have one case, you don't have to shut down the office. You don't have to go and tell all your 1,000 employees who are at work that, go test yourself. If there is AI which can help you just narrow it down to the 5 or 10 people that person has come in contact with, it will help keep everybody safe. So we come in from a workplace perspective, and to share that example, we have Dr. Kamal, who's from Vulcan AI, and very interesting solution which has been piloted. He will show you on how AI is being used in that context. Then another very interesting context is about from a financial perspective. So if you have investments and if you invest in markets, in equity and bonds, it's a big part of our concern, right? So are our investments safe, and which are the areas we need to invest in? So just like we worry about our net worth, I think from a GIC perspective, how do they ensure that the investment is safe? And to do that, they need to track the impact of the COVID-19 situation around the world. So there are interesting examples where you're using traffic data coffee chain data. There's a whole lot of different data sources which you can use quite innovatively to get an early warning signal in terms of either people not returning to work, businesses not opening, or the flip side, opening too fast, and that can pose additional risk. So we will have Jeff from GIC, who's a senior quantitative strategist, sharing what GIC is doing to monitor the COVID situation around the world. Then we also have, and we will close it by Alex, who looks after the APAC funds and the alternate investment team from Bloomberg, who will also share how to use various different types of data to get an early insight into financial and economic trends. So it's quite a packed agenda, so I will not spend any more time. And I will hand it over to Dr. Liu and Dr. Go to start their presentation on delivering smarter healthcare insights to combat COVID-19. Over to you.
Okay, thank you so much, Manik and Chris. Yeah, okay, I'll bring up the screen. Yeah, okay, thank you for having us here. Just wanted to give you all some background on ITIS. We are the largest health tech company in Singapore. We have about 2,800 employees. Our core business is in making sure that healthcare system works in all the public health institutions, be it hospital, be it polyclinics, or even the Ministry of Health. Our mission is digitize, connect, as well as analyze. So this is our core pillar that we have in ITIS. We are also the key founding members for AI.SG. So health tech to us, right, is actually more than just an IT system. It's in fact a combination of engineering and computer science. Some example would be like telehealth, vital sign monitoring, and even physical robotics itself. And one of our notable implementation known worldwide is the automation of our pharmacy's packing system. So this system actually uses robots to help pack medicine for the patient. This improves productivity as well as enhances the patient safety. When the global pandemic hit early this year, ITIS, we know that we need to step up. We need to support all our healthcare family members to fight this war against COVID. And for the past 2 to 3 months, actually a lot of us are given our best and commitment and almost like working 24/7. And whenever we have rest time, we will be also busy helping each other to do system testing, or in fact doing some manual works like pushing the equipment around. So with this commitment, actually we did a lot of projects in an impossible timeline. We developed an AI model that can help clinicians in just 2 months. We set up a data lake to collect all the COVID test results from all the different labs in Singapore. But even doing that, we know that we need to do more. And we fall back to one of our key pillar or our key strength, which is analytics. Using analytics, we use it as a workforce multiplier. And when we talk about analytics in ITIS, it's not a so-called random type of spark of thought or ad hoc thing or aftermath thing. We do it a little bit structured way because we need to use analytics embedded within the workflow. And having this pandemic, we identified 4 key areas where actually analytics can help the healthcare sector itself. So putting forefront, we also scout through the different companies, analytics company locally to see how we can collaborate with them to put things faster. And one such thing is actually iThermal, which our innovation lab team member work with a local startup to come up with this application. It's a temperature screening application, which is easy to implement and actually very cost effective. And at the early onset of the pandemic, actually we use it to protect our healthcare facility. Our main force during the pandemic work in expanding the capacity, because we know that if there is a real surge in the healthcare system, capacity must be increased. And within 5 days, we set up 500 beds in the expo for the CCF itself. And within 1 month, we actually convert 10 halls in the expo to be healthcare operation ready. By being healthcare operation ready, right, what we actually mean is more than just a physical expansion. We make it tech driven, or it's a tech facility that enable 24/7 coverage of our medical services. How do we do that? We use some of the technology that we are familiar with, which for example is the vital sign monitoring. We allow the patient to do self-assessment of their temperature, blood pressure, as well as their oxygen in blood. All this information is streamed real time to the server so that in form of dashboard, the healthcare worker can help to monitor their condition, whether it deteriorates or not. And the other thing we does there is also RPA, which should help the discharge of the patient. So by doing all this, we are actually keeping minimum contact with the patient and also keeping the workforce there very lean. So a very lean workforce can actually take care of a lot of people in the facility itself. The other aspect will be the test and track. Because during COVID, one of the best known solution is so-called social distancing, as well as test and track to control the pandemic. And doing this collection of healthcare data or collection of this lab data from the different labs itself is no easy task. Because in the lab system, they set up their database in a way to facilitate transaction or operation needs. Analytics is not what the system is built for. We collected the information and help to process the information that can be used for analytics subsequently by other ministry as well as other stakeholders itself. We use text analytics to harmonize the data. We use entity recognition to pick out if there's duplicate in the data itself. So all this is the use of analytics that we have in place when we come to supporting the healthcare family for the pandemics. And lastly, of course, is about the patient. Ultimately, it's about how the patient will have a good outcome, in the sense that all will wish that they can have a good taken care of and go home in a very shortest period of time. And that will be our main sharing of today, how we use AI to support the clinician. And of course, in this global pandemic, we see that AI is being used in many areas. And one of the areas we think will make the most impact will be AI for the prognosis of the patient. By prognosis, actually what we mean is that the outcome of the patient, the likely healthcare outcome of the patient, will they be discharged soon, or will they likely to end up in ICU cases, or even face the risk of mortality. So very happy with me today, right, is my key partner in crime in this project itself, Dr. Charlene Liu, who is the DYCMIO for the Changi General Hospital. Together with her, we will share with what we have done for this AI.
Dr. Charlene, before you begin, right, I think as all scientists and professionals in the data space, I think we tend to go straight into our work, right? And I think we just not really didn't formally introduce Dr. Goh. Right, Dr. Goh just goes straight into the agenda. So just allow me a few minutes, right? I think it's only fair that we formally introduce Dr. Goh, who is actually a lead data scientist now in ITIS, right? A principal specialist emerging services and capabilities group, right? And then now I think before Dr. Charlene present, I would like to just also share with people that Dr. Charlene is actually the director of the cardiothoracic radiology at Changi General Hospital. As mentioned, she is actually the deputy CMIO and director of innovation for the Sing Health Radiological Sciences Academic Clinical Program. So Dr. Charlene has been involved in data science and developing deep learning applications since 2015, and she begins with the cardiovascular imaging lab at Harvard Medical School, MIT Media Lab in Beth Israel Deaconess Medical Center. So with that, right, I'll now hand over to Dr. Charlene to actually continue to actually share with us your work. Dr. Charlene, please.
Thank you so much, Christopher. And I also want to express my thanks to Singapore Computer Society for your invitation. I'm sure it's not every day that you get a clinician to come and speak with you, but I see this as something that will happen more frequently in the future. I think as our needs align in healthcare and digitalization. So just to bring you through a little bit about, you know, what we as doctors feel is going to be the role that artificial intelligence is going to play in our future career and our future work. So here is actually a quote that was taken from the Royal College of Radiologists in the UK. So the RCR is actually a very influential organization, and I actually have had the opportunity to work quite closely with them in the past. They are their presidents, and in the UK they are also pushing, driving the effort to integrate artificial intelligence to make sense of all the data that they have in the National Health Service in the UK. So it's very much a global theme for radiologists everywhere. So AI is going to play a significant role in radiologists' future working lives. The AI pre-analysis of images by computers will help radiologists to issue actionable reports. So as you can see here, there are two tools that artificial intelligence can actually present to us as radiologists. So it can give us insights that we didn't have previously. So in medical image analysis, this actually provides the analysis, the computer-based pre-analysis of radiological images to help and detect and classify abnormalities. So not all clinicians are trained actually to identify all of these abnormalities. For example, in the emergency department, not all ED doctors can actually interpret chest x-ray or x-ray results. And so in the middle of the night, if there is no one on hand, for example, it may actually cause a significant delay before we can, get the help of a radiologist to interpret the image. So sometimes, it is a matter of where the needs are, identifying where all our needs are. And I think AI actually is poised to play a very important role in plugging in all these gaps. So the other area which we feel the AI is going to have very significant strengths in is in prioritization. We call this in medical terminology triaging. So you might have heard of this term. So essentially it's the same as on the battlefield, right? When you have a limited amount of time, you need to make decisions on the fly. You need to triage your patients into red, green, and orange. So those who need to be seen immediately versus those who can wait maybe till tomorrow. And this is actually not currently done in clinical practice all around the world, especially with digital imaging. And we feel that this is actually a significant area of need. Right now, for example, if you are sick and you go to the hospital, it's a first in, first out kind of diagnosis of your X-ray images or your CT images. So if you are actually very ill and you happen to be unfortunate and you present quite late in the day, you will actually have your images read, a significant amount of time later. So artificial intelligence can actually step in, plug that gap, and triage what is abnormal so that it gets seen first on the list, of reporting radiologists. So we feel that these are the strengths the AI can actually play in medical imaging. Okay, so Han Leong, sorry, can you help to? Yes, thank you. So this is the next. This is actually a kind of an overview of our team. As you can see, it's a very large team, and I think that actually underlines, exactly the point that, data science, artificial intelligence, big data work in healthcare is actually a very multidisciplinary process, and we definitely need the help and the expertise of multiple teams. So as you can see at the top, we have clinicians, experts in health informatics. So in this example here, we have actually in the clinical team not just me, the radiologist. We also have our counterparts in respiratory medicine. So those are the counterparts in, who see patients with lung diseases. And so we actually need to work very closely with them as well, because it's not just imaging, it's also, the management, which is downstream. So we need to get them on board and to give us those insights as well. In the middle, connecting all of the layers, we have data architects, data scientists, data engineers, and obviously, their importance cannot be overemphasized. And yet we also need to give them our input, and they need to give feedback to us. So it's a continuous loop actually. And I think this was exemplified very nicely during working on this project. We actually met up, very frequently, sometimes a few times a week. And I'm sorry to say that we put Han Leong's team at risk sometimes because they had to come to the hospital. We made sure that they are wearing their PPE. But nothing actually can replace, I think, the face-to-face collaboration. Obviously, we tried to do as much through virtual meetings, but having the team come on site, troubleshoot, was extremely helpful, and it helped to really, drive this project forward very quickly. I don't know if you can remember from the timeline. I think from start to the first results and implementation in our hospital, it took about 2 months. So that was a very, very rapid prototyping and deployment. And lastly, we also have, but not least, obviously, we have business translators, so people who will help us to actually translate this into our business models and deployment strategies. So we have a very, very large team, a very diverse team. Okay, so back to Han Leong.
Yes. Yeah, actually, that's a very correct thing. So it's the team-based effort that we bring it through. So actually, when we build this AI model, right, what will be our main challenge, in fact, is to bring AI model into real world. This, I can assure you, is no easy task. And from what our experience or the learning points we done in our first nationwide public healthcare institution predictive model in 2017, when we first launched it, we sort of summarize it in these 3 key statements itself. When we say state-of-art methodology, it's not just chasing the best technology, but it's to ensure that we don't reinvent the wheel, and we give our stakeholder the best what they can from the data itself. And the other thing is, of course, the implementation, how we can integrate seamlessly into their workflow. Because the last thing you want is to disrupt their workflow. It's a bit like a twist in the business as usual, but with the insights given to our stakeholder, not them knowing or not them doing a lot of things. And lastly, of course, is the explainability of it to the clinician. And I find that this is, in fact, the hardest part, because clinicians like Dr. Charlene, right, and many others, right, is one of course, the smartest people around that we have to work with, and they will keep challenging whether the model is giving them the correct result, how come the model is giving them some suggestion, and do they trust the model? They rightfully ask all these questions because it's in fact the life of the patient they are dealing with, so they have to be very careful. And I just want to summarize some of these learning points in a quick way to share with us how we are tackling it. State of art of the technology itself, I think nobody will disagree with me that, in fact, deep learning AI changed the world quite rapidly in the past 10 years. In the very beginning, it's ImageNet. Many say that this is the data set that changed the AI world itself. And in fact, I would have agreed so. And in 2012, the CNN changed the way we are doing a lot of machine learning. So CNN won the best competition in the ImageNet, beating a lot of the conventional method, rule-based method. And ever since that, every year you can see there will be a new algorithm being pushed out, or every half months there will be a new methodology, be it pre-processing, be it tuning of hyperparameter. So if you just do a computation of or a permutation of things, you probably have to try a few hundreds different algorithms coupled with the way they have to be tuned. So if you believe in the no free lunch theorem in the machine learning, you in fact have to experiment with all of them before you can find the optimum answer. So the challenge here we face is how do we deal with this explosion of algorithms in AI? Just want to share with you how we do that. We fall back to the conventional or the old wisdom of computer science. We do 2 things, but we merge them together. One is divide and conquer, which I believe all the computer science students will be very familiar with. The other is pair coding itself. By divide and conquer, what do we mean is that we need to know that what is actually the best thing we can do in terms of enhancing the algorithm that can give the increase in the performance. For example, in data augmentation, does it make sense to flip the image around? Chest X-ray rarely you can see that flip around. And what about this random erase or this cut-through method, where we pocket out small black dots in the images, so we make it generalized. In fact, we find that to be the most useful. So in short, we are trying to find out what method works for our use case and what don't. And we can see that by even grouping them in big category, we've got 5 key areas to tackle with. And then subsequently in the data science development, one of the so-called challenge we have, or the fear that we have, is that all codes will run. If you so-called whack it hard enough, you debug it hard enough, anything can run. But will they give you the optimum answer? Sometimes no, sometimes they even give you an over-promised answer or over-promised performance, and which we call it leaky data. How do we address that? And this actually so-called slow us down in terms of that, because we have to keep going back and check the code, whether it's written correctly, whether we did something right or wrong. So what we do here is that we break the team into 2. So by breaking the team into 2, we do this methodology called pair coding. We are trying to do the same thing, but then we use different methods to it. So in short, we do two different frameworks. One is PyTorch, another one is Keras, which is TensorFlow. And we check our outcome. If the outcome is very different, something must be wrong. It can be a warning of overfitting, or it can be a warning that someone did something wrong with the code. That's why we don't have a good result. And by doing so, we actually have no longer the fear that we are coding wrongly, and we speed things up. We just code itself and we check back each other for the answer. And when there's a different challenge that we cannot overcome, we actually ask each other team. And the best of all is that this type of method also institutes some competition like Kaggle informed, so that we will keep on trying to outperform each other. So the benefit is quite high in this. We cover a lot of ground in that 2 months. We also are quite sure that the code that we churn up is quite reliable. And lastly, that we know that we can actually get the best performance out of the code. And of course, the other thing is that after we have a good AI model, what does it mean? Does it mean that the job is complete or the mission is complete? Actually, no, it's only half of the journey. The other one is how can we deliver the information to the clinician in the seamless way? In medical system or medical IT system, there is largely 2 key things. One is called electronic medical records, EMR. The other, which radiology use a lot, is the RIS-PACS system. Both systems are very well established, and there's many handshaking interface or protocol. If we try to meddle with the system, our change requests in the IT terminology will have to take months. So we need to find ways to slip in this predictive result to the clinician effectively. And that's what Dr. Sharin had previously mentioned, the discussion that we have. So it's the design thinking workshop that we have with each other. And we finally found a very nice sweet spot, because we realized that all the information of the chest x-ray eventually have to end up with a radiology in the first stop. And having the radiology there, what we tweak the application, we make it into a thin kind basis where it will reside in the workstation of the radiology. So the radiologist will just have to click the so-called DICOM image of the chest x-ray into the application to get the result itself. So there's minimum disruption to them. And the best part is that the AI helped the radiology to make some assessment, and the radiology also helped AI in terms of the data quality control. If the image doesn't look right, if the image was taken wrongly, the radiology can flag it out. And after that, the information then will pass through in a normal route to the respiratory clinician in the so-called emergency ward, or in terms of the inpatient ward, where they can use this information to give the assessment for the patient condition. And of course, the last thing, which I just now said, which is explainability, I think best leave to Dr. Sharon to explain how the AI have been helping her. Yeah, Dr. Sharon, please. Yeah. Dr. Sharon, I think you need to.
Okay. Yeah. Okay. Thank you. So, just a bit of background. So I actually strongly believe that before we embark on any AI projects in healthcare, we actually need to ask ourselves if there is a clinical need. So the needs-based analysis is actually crucial before you embark on any AI project. Obviously, the healthcare space has a lot of needs, but this is actually a very good example of where we asked ourselves the question. Right at the beginning of the pandemic, we were seeing a lot of cases, worldwide. The numbers were going up, and yet, there wasn't a effective way for doctors to determine which patients were going to get very sick. In fact, those that needed intubation and ICU admission, most of the times were taking us by surprise. It was, almost unexpected that some of them, seemingly fit and quite well, deteriorated very suddenly, and some even unfortunately passed away. So we decided this is actually a very important clinical need that we need to address. And actually, looking at the current tools that we have out there, there is actually nothing that we have in our toolkit. And so we had to build it. We had to build it from scratch. And I actually strongly believed at that time that artificial intelligence would have the answer there somewhere. And so I reached out to our friends in ITIS. So another lesson that we learned is networks are very important. So we already had very strong collaborative work with ITIS previously. And so when we had the COVID situation, I just literally picked up the phone and talked to, Health Insights team, and they were very, very forward in coming to offer their support to us. So for that, we're very grateful. Okay, so I'm just going to show you the heat map. So this is actually from a clinician's point of view. You can see on the top row, we actually selected these two patients because they're very similar. So, they can act as case and control. So the top row, you can see that there's a chest X-ray of a 42-year-old man who was COVID positive. And, just by visually, the naked eye, you might see some patches of white. I don't know if you can appreciate. I will just put the arrow here. You can actually see some patches of white in the lungs. Now, those are areas of pneumonia. But the thing is, do we know whether this patient will deteriorate or not? So we don't know, but we applied deep learning analysis, and you can see on the right-hand side of the screen, the heat map is overlaid on the X-ray. So the areas of highest activation are going to be towards the yellow, orange, red spectrum. So you can see that it's actually highlighting the patchy white areas. And this patient actually was given the risk score of 80.6% chance of needing ICU admission. And in the end, he subsequently did need ICU admission for deteriorating oxygen saturation. Okay, on the other side, this is the control case, 47-year-old patient with COVID positive as well. And you can see the chest X-ray on the bottom. There are also some white patches in the chest X-ray. But if you overlay the heat map, you can see it's not really activating very much. And this patient was given a risk score of 17.8%. And subsequently, he did not require ICU admission. Obviously, these are just examples. It is not a statistical proof of evidence that, that it is effective. However, we ran some statistical analysis later on, and we proved that the area under the curve was, above 0.83. So it was significantly accurate for clinical purposes. Okay, so we'll just skip to the next slide. So what is next? So now we've built the model, and we've actually proven that it is robust enough. We have done prospective validation as well as retrospective validation. But this is another thing that we are discovering as we go along. So with data science applied to healthcare, we need to follow the same stringent methodologies that's applied throughout medicine. So doctors are by nature a very skeptical bunch. So we do need very strong evidence. And the way we do that is we actually emulate the health biomedical research. So studies, tests need to be validated on one site, and then they need to be validated externally in external sites, and then they need to be assessed, published in peer-reviewed publications. And by that stage, the AI model becomes more and more trusted by clinicians that they can see themselves applying it to their own patients. So we aim to actually validate this same model at our other tertiary healthcare institutions. So we've reached out. We already piloted in CGH. So now we're reaching out to SGH and Sengkang General Hospital as well, and they've already agreed to come on board. So moving forward, we call on collaborators, on researchers, anyone who's interested to further enhance this AI solution with us.
Yep. Thank you, Chris. That will be the end of the presentation for us. Yeah.
Great. Thanks a lot, Dr. Goh and Dr. Charlene. Very interesting presentation. Next up, still staying within home, like Singapore, we have Dr. Kamal Mana. He's currently the head of AI of Vulcan AI, a company that focuses on building applied intelligence solutions for Industry 4.0. Previously, Kamal was a managing director at Accenture, where he was leading the AI Center of Excellence of ASEAN. His areas of expertise and patents include cutting-edge AI capabilities such as adversarial network deep learning, reinforcement learning, signal processing, etc. He holds a PhD in industrial and system engineering from the University of Wisconsin-Madison and has 10 plus patents and 10 plus peer-reviewed publications in the area of AI and data science. So I will hand over to you, Dr. Kamal. He will be talking on safe distancing and contact tracing using Vision AI. Dr. Kamal, please.
Yeah, thank you. To start with, I think it was a great presentation that showed what ITIS and clinicians are doing to keep us safe. I started my career in general electric healthcare, looking at MRI and CT images, so kind of it's also something that is close at heart for me. But what I'm going to talk about is a slightly different topic. Again, application of AI, but our idea was how do we help organizations be robust and reduce disruption from COVID, right? As they start to bring people back to work, how would you use AI to do two things? One, leverage Vision AI to kind of nudge their employees into safe behavior, right? Are you keeping safe distancing? Are you wearing a mask? How do you do that automatically using AI? Second is, if there is, let's say, a COVID case in an organization, how do you leverage AI to quickly identify who among the people in the office or at the workplace are at risk? So you can do a very targeted intervention once something happens. So those are the two things that I'm going to talk about in terms of the solution that we have built and are piloting right now. So we are a fairly new company, started a year ago. We basically focus on AI. We're a deep tech company focusing on AI. So our team is a combination of deep tech AI specialists, data engineers, UI, UX, and full stack developers. So we provide end-to-end solution. We focus on few key products, but essentially the common link between them is IoT data and AI. That's basically what we focus on. So in terms of what we do as Vulcan AI, there's obviously the services part. So we provide AI and big data services, but we've also built a set of solutions which go from using AI in the agriculture domain to AI for manufacturing for quality control, and then AI in the WorkSafe, TrackSafe area, which is what I'm going to talk today. So essentially, these are solutions that have been built at the back of our Vulcan AI, Vision AI solution that helps us quickly generate these applications on top of that. So when the whole COVID thing came and we were thinking, how can we help? Our key strength is in the Vision AI solution that we have. So we've built a foundation of a model zoo with a number of different AI algorithms and a solution workflow that allows us to quickly experiment and identify what's the best model for a particular scenario. And we built that at the back of a number of different solutions that we'd already built. So we basically use Vision AI to help agriculture companies use satellite and UAV images to understand how they're performing. We are also working in application of Vision AI to make workplaces safe by detecting where there is slip, trip, fall, or a near miss of slip, trip, fall, whether it's a workplace, a construction site, or essentially any work location. How do you keep it safe? We've also built solutions that look at how to use Vision QC in manufacturing to detect defects as the product gets manufactured, or in the harvesting side from agriculture, where we've actually fit our AI on a phone. So the example that you see at the bottom is essentially one of our clients where they harvest fruits, and they can just take a photograph using a commodity phone, and our AI solution is basically shrunk to fit that phone. And with no connectivity, it can basically run and tell them how good is the harvest. So we had built a number of these solutions at the back of our product. So then we thought, why can't we just leverage this to build a solution for COVID to keep the workplaces safe? And therefore, this whole product came out a few months back as we had to work towards this solution. So we built basically two components, but before we go into that, the reason we thought it makes sense to build a solution looking at it from an enterprise perspective was the significant cost of disruption, right? So lockdowns, or if you see across the world, circuit breakers can only be done up to some period of time. We have to start getting people back to work, but how do you do that in a very safe fashion, right? And the cost of not doing it well or when something happens is quite high, as you see through these examples. So as I was saying earlier, we then looked at the entire process of what happens and how do you prevent it from happening. And we focused on two key areas. One is what we call as WorkSafe, which is essentially using CCTV if it exists, or our custom 3D sensors that can be deployed, again run on the edge, which can be put in the workplace. And through the video that comes in, we basically process that to identify what types of behavior are high risk in real time. So if social distancing is not maintained, or if a person is not wearing a mask, it kind of identifies that. But we also didn't want to get too much into the private life or the privacy of the person. So rather than basically identify who the person is, we provide nudges in terms of either sending a message to that specific person or having a view of across the room where there are high risk hotspots. So kind of provide a real-time nudge for people to change their behavior without naming and shaming them. So there's a fine line, as you'll see through our presentation, between using video to identify behavior, but then what do you do with it, right? How do you provide these nudges without being too much in the face? So that's basically the WorkSafe part, is preventive. How do you prevent by basically adhering to better practices? The second part is TrackSafe, where if a particular person is infected, typically what happens is you could be, if you have CCTV and you know a person is infected, there are a number of challenges. You need to figure out when did this person come in, who all did this person come in contact with, and that could be hours of camera footage across multiple CCTVs. So what we've built is a solution that kind of mines through all the video cameras. You could have 10, 20, 30, whatever number in a particular office. It mines through all of that video footage, maybe up to last 20 days, and figures out with the person of interest who's been infected, who could have come in contact, and does that very quickly, because speed is probably an important aspect in terms of identifying who is at risk. It does that fairly quickly and provides very accurate, targeted kind of list of people who are at risk. So the organization can then take it from there to isolate these particular individuals, but let the rest of the business continue rather than shutting down the entire organization. So those are the two key areas where we've basically built our AI solutions, WorkSafe and TrackSafe. So next few slides, I'll go through a bit more detail and then show you a demo of how these two solutions work. So there's a few key components and talk about WorkSafe, which is if I have a CCTV camera or our own 3D sensor that's running, we identify, we obviously have to detect people, then detect where they are, and with respect to each other, how far are they, right? So that's all done automatically through a combination of different AI models. And then the second part is how to run it fast enough on the edge so that you provide then gentle nudges to people to remind them to do the right thing, either through displays at the facility, which I'll show in a short while how does that look, or direct SMS messages to people to basically nudge them to change their behavior. Again, different organizations, different locations, different camera settings are quite different. So basically the way we built our solution was it can be applied to different types of CCTV cameras, different locations, different heights. So it automatically calibrates itself. And then we provide, configuration to say what distance is close enough. So basically the business level configurations that can be done to identify when there is safe distancing alerts that are happening. Like in this example here, this is a regular CCTV camera, but through the use of some interesting math where we still identify distance in both in XYZ kind of 3D coordinates, we are able to identify who are basically being in close distance to each other. So that's one part. Then from the other key dimension in terms of how COVID kind of spreads, obviously wearing a mask is really important. At least most people believe that. So how do you automatically detect that, right? So, and then detect that again in near real time and provide nudges to remind people to do the right thing. So we can do social distancing, we can do face mask detection. And then if we look at it from a facility perspective, then you would have a number of these cameras. So then how do you then configure, let's say 10, 20, 30 cameras to run this in real time and provide these alerts, but also at the end of the day, create a report that the safety officer can look at and see where potentially are higher risk activities happening, so they can take some nudges to basically get these employees to change their behavior. So that's essentially the whole workflow in terms of how WorkSafe works. So we configure the camera, we then do distance person detection, distance detection of these individuals, and then face mask compliance, and then kind of configure all of that into an alert that can be sent to the individual or can be sent as a report. So if I quickly go to the demo of the product that we have. So this screen that you see is what is running live at our office where I'm actually presenting. So if there are organizations with a number of different facilities, they could basically see what's happening across all their facilities in one view. And then this tells you overall what has been happening till today. So if I press on face mask violation in a particular facility, it says where is the camera and when did it happen? And if you need to send an alert to that particular area, individuals in that location, you could send that to an SMS alert or an email message. Now, for people who have access to these images, and this is something that only people with the privilege to see those images would basically see it, you can also see what is this alert about. So this was again a test that we were running today morning in our facility just to show you some of these examples. So these guys do wear masks normally. So this basically tells you how does the model work and how are we detecting a no mask kind of a violation. The same thing applies for distancing as well. So again, as I was saying, I think the challenge here was if you don't have a 3D kind of a stereo camera, you have a single eye, and how do you measure distances using that? So we've done some interesting work to basically figure out, even though I'm only seeing a 2D image, what is the distance between me and CJ here, who's one of the data scientists building these capabilities. And then again, it generates the alert, the same flow. You can look at the link and see who are the people involved, if you have the access rights, and you can basically see that. So that's essentially the WorkSafe part of it in terms of how it works. Now, the other part angle to it is not all organizations will have their CCTV cameras everywhere. And sometimes a single vision camera is not enough. So we have a 3D sensor that can be deployed in high density kind of locations, because there you need to have more accuracy in detecting distances between people. So the example that you see here is something that we constructed in our office just to show that high density does not mean there is no social distancing. So in this example, our 3D sensor, which completely runs on the edge, is tracking each individual, looking at their 3D distances, and it basically is continuously checking, is there a distance alert between these individuals or not? So as people start to come in, you can see that there are more than 4, 5, 6 people coming in, but they are all maintaining the social distance that is needed. So it can be a safe workplace with a lot of people. Of course, as they walk in, you can see that there is movement, and then some of these individuals are getting too close to each other, but it's not a continuous or a significant close distance that happens, right? So again, through the use of AI, the idea was we can get workplaces safer through a more reliable, targeted, intervention by detecting when there is an actual problem, rather than just leveraging a very rough kind of view of, okay, what's the density in a particular work location. So that's more around WorkSafe. And then these are some reports that can be generated end of the day for the safety officer to look at, right? So we process real-time alerts. That happens end of day. There's a report that goes out that says in each work location, what was the pattern in terms of number of people, which are the areas, like in this case, where there was a lot of density in this case, right? Where a lot of people were pulling up, and potentially that can be used to redesign the office or basically provide some nudges to people to change their behavior. Same thing occurs for, let's say, a mask alert here. So we remove people. So again, if this report needs to be circulated, we don't need to show who it is, but it basically says person sitting in this chair in this location had the highest duration of not wearing a mask. So again, it provides an end of day view of what's happening. and how do you take action from that perspective. The next part is to do with TrackSafe, which, as I was saying earlier, the idea is if a person is infected, then how do you figure out a more targeted way of identifying who is at risk and essentially quarantine them rather than quarantining the entire facility. So again, the idea here was we're not doing facial recognition, identifying the face of the person. They're using because people are wearing masks and you may not be providing a nice view, a front-facing view in a CCTV that shows your entire face. So instead of going into identifying face of the person, facial features, we look at the overall profile of the person and use that to kind of identify this person across cameras the whole day, and then figure out who this person has come in contact with. So if I quickly go through the demo for this one, kind of our product view for this one. So if I go to so once a particular person has been identified as a person of interest, the same solution, we can basically upload an image of the person. Again, the image of the person may not be from that day. It could be an image across a different day. And then the model runs at the back end. So across the whole day, it has identified unique people because it's tracking every person as they're moving across, identifies unique people and shows their photos, tracked or already matched to some level of similarity. So in this case, Prashant is here, and then we're basically saying, these are the images that we think are the most similar. This is the same person. So again, it's human plus AI. So we can basically confirm that the persons that are indicated here are correct. And then we basically do close contact, identify who came in contact. At the back end, there's a graph database that goes and searches, because there are millions of individual pictures of people across 25 days. So it basically goes back and searches, identifies who has come in close contact with Prashant, how long has been the duration, and how many times it has happened. So we also say what we call as degree of contact. So first degree is if he's the person of interest, another person has come in direct contact, then that's first degree. And then it says how many times has the person come in contact, what has been the duration, what's the timestamp. And if you want to look at who this person is, again with the right authorization, then they can even see the best picture. So what we call as best picture is, to explain this, here Prashant has come in contact with Alan, but it's quite far away from the camera. So you can't really know who this person is, right? But because they're tracking the person through the day, we extract out through AI the best picture of this person, which can then be used to identify who this person is, right? Or you could also look at this person, what time did they enter the office, and triangulate through a safe entry to say who this person is. So there could be multiple ways in which we could do that. But the key here was being able to search entire 20 days, identify who has come in contact, and give a best post picture of that person so that you know who the person is. And this works across all cameras, right? So as I was saying earlier, we select each camera that we want to analyze, and it automatically mines through that, through a graph TV, and gives you all the relationship that you have. So at the end of the day, you can just export this list, and this becomes the target individual set that we need to go and investigate or quarantine from that perspective. So that's in a nutshell, very quick view of what we have built, which basically combines WorkSafe, which is always on, analyzing existing CCTV camera or our own 3D sensors to nudge people to have better behavior. And that also kind of identifies who has come into close contact with whom. Then contact tracing is if an incident has happened, you put in the picture of the person, it mines through all the cameras, all the frames, which could normally, if a human has to look at it, we did some calculation, takes days, months to basically go through it properly. It does that automatically and extracts out a final list of people that you need to look at and intervene very quickly, right? So we could process 20, 30 cameras in under an hour if you look at, let's say, last 20 days. So speed is also a key aspect of what we've built to allow for very quick, but at the same time, very accurate contact tracing. So that's a quick summary of what we have done. Later on, we'll be happy to answer any questions that you have. Thank you.
Thank you, Dr. Kamal. Thanks for sharing. I think it's something really very relevant to this COVID situation, good application of image recognition. I'm sure that it will be very relevant to a lot of office, at least if you have a positive case, you do not need to evacuate the whole building. Now, can I quickly then now introduce the next speaker, Jeff Zhang. He is currently a senior quantitative strategist in GIC, where he harnesses data science and technology to provide relevant, impactful analytics and insights that add value to our GIC fixed incomes global macro investment strategies. Since the outbreak of COVID-19, Jeff has been one of the key persons behind the implementation of the various analytics to track and monitor the situation of COVID-19 around the world. He provides a write-up of his daily observations and update GIC senior management on a daily basis. Jeff holds a double bachelor degree in computer science and business. He currently resides in London. His topic will be sharing how GIC harness data analytics to monitor COVID-19 situation around the world. So previously ITIS and I think Vulcan AI, Dr. Kamal has been talking about within Singapore context. We are now starting to move out. We will be more focusing on the kind of data being used and analytics rather than machine learning space. So I'll hand over now to Jeff to quickly actually go into the presentation proper. Jeff, please.
Thank you, Chris. I hope you can see my screen.
Yes, we can.
Okay, great. So for those who are not familiar with GIC, GIC is a long-term global investor. So understanding the fundamental economics is crucial to our investment decisions. Unlike the great financial crisis in 2008, our current global economic crisis is caused by COVID-19 pandemic. So it is important for us to understand and monitor the COVID-19 situation. In this session, I will share how we are tracking new cases, testing, hospitalization, and economic activities, and also understanding the efficacy of measures put in place, as well as recovery in terms of macroeconomics. First, let me talk about how we track new cases. Why not just let me bring up our Quant Analytics platform. Here we go. The most intuitive chart is the bell curve chart, where new cases of each country are aligned so that their peaks match. It is a good indicator if we want to track whether the curve is peaking in a country or not, as you can see here. These peaks are aligned. It is also good at spotting the second wave early. So from this chart, we actually spotted the new outbreak in Austria and Australia, even before the headline breaks, as you can see here. In the second chart, I believe you have seen it many times. It is plotting cumulative cases with log scale against time, where you can compare with imaginary days to double lines, the dotted line here, as you can see here. This is particularly effective before the countries start to flatten the curve. We can easily identify if the infections are accelerating or decelerating, which was not easily observed from the bell curve chart that we showed before. So until now, we are still using this chart to track new epicenters in emerging market countries. The shortcoming of this chart is that it becomes less sensitive when a country has already peaked, because the second derivative is not very easy to see or very sensitive on this chart, as a concavity becomes less obvious because of the log scale. So to overcome this problem, we have this log trajectory chart where x-axis is no longer time, but cumulative new cases, and y-axis is daily new cases. A good thing about this chart is that after a country has been peaking, the drop is more visually appealing and more visually sensitive. It is easy to use this chart to see if a lockdown has been effective or not. Also, this chart is good at identifying a second wave. Examples can be, say, US here. You can see a very obvious second wave, and Japan. And our home, Singapore, is doing pretty well. I would say on track. Singapore is here. And some countries actually, unfortunately, haven't seen any improvement, like India. And some countries see improvement and there's no bounce back or second wave. Let's say Malaysia and Thailand as an example. Let me switch back to my slides. Here's an example of how we use data to make decisions on closing office. Back in March, the senior management in our London office was deciding whether or not our office should remain closed and everyone just work from home. At that time, UK was so under-tested that we couldn't make a sound decision based on the official numbers. So we offer our opinion by replicating a model from Imperial College to estimate the real infection rate in London by regressing the infection rates of inbound UK traveler to Singapore, Taiwan, Hong Kong, and mainland China. Why these 4 countries? Because these 4 were the only 4 countries that still tracking individual cases at that time. The result back then was that we believe 8 out of 1,000 people are infected in London, which is considered pretty high. So we decided to keep the office closed. So in terms of data, the travel data we can get from the World Tourist Organization for Traveler, and we have the link on the footnote here. And the confirmed case data for each country are from their health authorities. Other than new cases, testing and hospitalization data are also important. The government makes decisions on lockdowns based on how overwhelmed hospitals are. So we focus here more on US. Data is very easy to get for most of the states. You can get it either from the individual state's authority or the famous COVID tracking project. In the first chart, you can see 2 lines. The blue line is the new test confirmed, the new test performed in the US every day, where we can see testing capacity is constantly growing. But is it growing fast enough? Let's look at the orange line, which is the test positivity ratio. This is just a new confirmed case divided by total tests. A low ratio means we have enough tests, and the consensus is that 5% is good enough for a country to lift the lockdown and resume economy safely. From the chart, we can see in mid-June, US actually was there at the safe level, but now it went back to 10%. Some politicians US claim that the growing number of new cases are because of more tests, and the second wave is not real. But the data shows that's not true. US actually needs more tests until it is able to bring down the positive ratio below to 5%, let's say, in order to safely reopen the economy. The second chart shows that the pickup of positivity ratio will also observed in all hotspot states if we do the same thing on the states level. We also track the hospitalization capacity using CDC's weekly estimate. Based on how far we are from the full capacity, we estimate how much possibility a state might be closing again. Let me just show you one example of Florida here. As you can see, Florida has, during last week of June, it has an average of 72% inpatient occupancy, and it is 5% higher than previous week. So that means the situation is getting worse. And another example, probably Dakota here, we can see that occupancy rate is pretty low, which means it's less risky from the fundamentals perspective. And it's less likely for South Dakota to issue another lockdown than Florida. So this data is from Federal CDC COVID-19 module, and is weekly published. How do we track economic activities? Ultimately, our goal is to track the impact of COVID-19 on economic fundamentals in order to make better investment decisions. There are some data that we are using for this purpose, and what I share is all publicly available from various data sources, so everyone actually can go and download the data and take a look. First of all, the Oxford Stringency Index, it shows how strict the government are imposing lockdowns to curb the virus. We look at individual countries, and we also construct collective indices in regions or group of countries that we're interested based on our investment portfolios. We also deep dive into the index and break down into different components. Some component might be more related to GDP growth than others, and some may be more related to public health. So we can use these sub-indices to now cause GDP growth and indicators like activity level, SLAC, and many other things. In a crisis like this method is more effective than normal nowcasting methodologies, I would say. Other than stringency index, there are other alternative data that we use to picture the underlying economic status. The most common usually publicly available data are Google Mobility and Dallas Fed MEI. Google Mobility is tracking the length of stay at various places, and Dallas data is the first principal component of 7 cell phone-based geolocation variables. We prefer Dallas over Google because not everyone uses Google Map all the time, especially if you know where you are going and you don't need to search on Google Map. Both data are publicly available and considered quite real-time in macroeconomic terms. So you can see from the chart 1, the first chart, is the Google mobility, but we actually massage the data a bit. What you can see here is an inverse value in y-axis because we divide the time you spend at home by the time you actually are out. So we call this go out proxy index in GIC. As you can see, there's a black line here, which is Korea, South Korea. Probably you can't see the text, but we can see that South Korea, the shape is much lower. It's much lower and flatter than other countries because South Korea actually controlled very well in the pandemic from the beginning, and there's no second wave observed. We also look at table reservation year-on-year change as a proxy to the hospitality sector. From the first chart, we can see that Australia and Germany actually recover faster than US. Also, Affinity published credit card spending year-on-year change that can be used to track consumer spending recovery. Latest observation from the second chart, actually is not the latest, by end of July, by end of July, the data will be different, but end of June, the data shows the credit card spending actually paused because of the second wave in the United States. Okay, so both data, the restaurant dining data can be found from the open table, and credit card spend data are from the economic tracker. Actually, they provide more indicators other than credit card spending data. So I also encourage you to take a look. Another example is home-based employment data, that is leading weekly jobless claim, which might identify investment opportunities if you see the discrepancy between the market and what data suggests. So where do you see the leading part is, if you can see the vertical dashed line here, we can see that the home-based employment data actually, it come up, it's real time and is earlier than weekly jobless claim. So we believe next weekly jobless claim probably will drop. Last but not least, I would like to show you the TomTom traffic indicator that we institutionalized. So each chart here is the traffic congestion index in a week for one city. So here we show New York and Shanghai. This is provided by TomTom. The blue dashed line in each chart is the last year's average level, and green dashed line is last week's index level, and the orange line is this week's. Here we can see that New York is only at 38% of last year level because US is still in the biggest epicenter. Shanghai instead stands at more than 90% of the last year average, which indicates that China has almost recovered from its previous lockdown. So from macroeconomic perspective, you probably want to say China will outperform US in terms of the economic activities in the rest of the year. So here are all I would like to share today. I will be more than happy to take any questions later in the Q&A session. Thank you.
Thank you, Jeff, for sharing insights on how GIC is tracking COVID situation around the world. Next up, if you are actually into investment or you have your money or going to invest, we would like now to introduce Alex. Alex has been with Bloomberg since 2015 and manages the regional data team for mutual funds, ETF, portfolios, hedge funds, and private equity. He currently is based in Singapore and has a decade of collective experience in the field of data analytics, industrial engagement, and fund management. He holds a master's in business commerce with UWS Sydney, Australia, and a bachelor in arts in diplomacy from DLS CSB Philippines. Today, he will be sharing with us an insight on the financial and economic trends in the past 3 months, powered by Bloomberg Global Data. Alex, please.
Hi everyone, as Christopher mentioned, my name is Alex and I am based in Singapore, and I manage our mutual funds and alternative investments team for Bloomberg Global Data. So today I'll just briefly share about what we've been seeing from an economic, financial, certain sectors point of view during the past 3 to 4 months when COVID really hit pretty much the global economy. Just a quick summary of what we do in Bloomberg Global Data. So Bloomberg Global Data, we're essentially, or we like to call ourselves the epicenter of Bloomberg. So we essentially acquire the data from multiple sources through technology or relationship. We process this data. So we have technologists and subject matter experts in our department that focus on this. And then it ends up getting published in multiple platforms, predominantly the Bloomberg terminal, which I guess a lot of financial people know, but some of the data are also coming out in Bloomberg TV, Bloomberg News, and other platforms. So for the agenda for today, we're gonna share certain trends that we've seen from the data that we collect. Just a note, all these insights are again found through the numerous platforms that we have, and I'm gonna go through this from a timeline perspective, from certain trends that we've seen in March when COVID started, during the initial or the mid period, which is around April, and then something that we saw that just recently in June. We will first look into a regional context and check out how investors are cashing out on certain exchange traded funds, even if those funds are providing high returns. And how the pandemic has forced or has, I wouldn't say forced, but has enabled certain companies to actually go back to their existing investors to raise more funds to essentially make the company continue its operation. And I'm going to bring it back home here to Singapore and to just talk about certain data points historically, where Singapore actually went through certain crises and what Singapore did in order to get out of those specific crises. So first, talking about okay, there you go. Investors when it comes to ETFs. So this was a trend that we saw back in March when the COVID situation was just unfolding. Border restrictions across the globe were just being implemented, and the equity benchmarks, which essentially looks at the performance of stocks of a certain economy, were actually plunging down. The main highlight of the data that we saw is that investors were still fleeing ETFs that were Asia focused, despite some of these ETF instruments providing high return. So a couple of figures, some interesting figures that you might find insightful. We saw $2.9 billion net flows to this instrument called an inverse ETF across Japan, South Korea, and Taiwan. These are the three biggest markets in Asia for such inverse ETF product. That is about 70% of inflows that we saw for the whole of 2019. So can you just imagine the difference between that specific quarter one versus the whole of 2019?
Alex, may I interject for a while? Your slides is still at the covering page. The cover page.
Yeah, there's only one slide, so essentially it's just
Oh, okay, okay.
Is it on the investors are exiting some risky ETFs? No? Okay, hold on. Let me try to. Is it sharing now? Okay. You see the ETF slide now?
Yep, you can see now.
Okay, cool. Okay, so just going back to an inverse ETF, like what I was talking about earlier. So an inverse ETF is an interesting instrument. It's actually designed to move opposite the direction of a benchmark. Most ETFs, as it's a very basic instrument that even retail investors go to, they know it as someone that tracks the economy. So an inverse ETF is, as the name suggests, someone that goes opposite what the economy performs. So what happened in the health crisis, it has dragged down the benchmark indices across Japan, South Korea, and Taiwan, thus boosting the returns of this inverse ETF, opposite reaction. The outflows essentially mean that even though this inverse ETFs were providing really good returns, people just wanted to cash in and really like take profit from their investments. We often see outflows in highly volatile products because people are being risk averse and they just want to take profit from what they have. Currently, this type of product, the inverse ETF, as of March there was about $7.3 billion invested in this type of asset globally. So it's really a big product, essentially. Okay, next I'll share a bit about from the company's perspective. So earlier we're looking at a financial instrument. Now let's look at how companies have been performing. I mean, it's not a very rosy picture, as we know, in terms of company funding. But this data was about, we analyzed this data around April to May, so about 2 to 3 months ago, in the what we call an equity holding space. We saw essentially companies trying to sell more of their shares to existing shareholders, and this was at a 6-year high during this specific period. So what does this essentially mean when you try to sell your shares to your existing shareholder? It essentially means that these companies are seeking additional funds to weather lockdowns that have virtually shut down the economy. So their first go-to for funds is essentially the people who are already invested in that specific company. So according to the data that we saw, Asian companies announced a total of $9.3 billion of right offers in April alone, just in April. So this is the most since August 2014. A bulk of that figure is actually attributed to a $7 billion right offering by a big Indian conglomerate. Another sector that we know that was heavily impacted by this COVID situation is the travel and airline sector. We saw a couple of Asian airlines also trying to sell equities to their existing shareholders, such as Korean Air, when it was actually looking to raise about 1 trillion won as a rights offer as well. And lastly, close to home, we also saw Singapore Airlines trying to raise a couple of $1 billion for capital raising as well. Beyond airlines, an interesting trend that we saw when it comes to sectors is also the travel agency sector. And a country that really stood out in this sector is Australia, of which we saw a couple of big travel agency names trying to raise about $141 to $256 million from rights issuance as well. During the time of this analysis, Australian firms have been the most active in the region when it comes to capital raising, either through follow-on share sales or right issuances. Out of the 87 right issuances that we saw in April, 34 were actually Australian companies. So that gives you a really broad view of, certain economies are, focusing on certain right issuances, ETF on certain markets as well. And I wanted to wrap it up with Singapore. So this is actually a data that we looked at about June. So just fairly recent data. As we all know, this is a global crisis and Singapore has not been spared by it. This pandemic is really proving as a test to Singapore. However, I emphasize there reinvents itself again. Singapore actually has a reputation for continuously reinvesting itself during crisis times. Being a small country in terms of land size, Singapore has managed to establish itself as a leading international finance and trading hub. So I will just quickly share some of the times wherein Singapore actually reinvented itself right after a crisis. So during the Asian financial crisis in the late 90s, Singapore actually entered into numerous free trade agreements, such as the US-Singapore Free Trade Accord in 2000. The country also built up and strengthened its biotechnology sector, thereby lessening its reliance on electronic exports. So this was late 90s. And then the SARS broke out in the 2000s, which was also a health crisis. What Singapore did after that was Singapore actually looked into its tourism sector and built what we know now is the Marina Bay Sands. So previously, casinos were not allowed in Singapore, but as a growth strategy after the SARS outbreak, the Singapore government ended up building or allowing Marina Bay Sands. After the global financial crisis, there was also an increased investments in R&D, energy labs, and making the city more sustainable and greener. That's why now you have a lot of these things that we were talking about, biotechnology, green city, we just live with it like it's normal, but it was actually a reaction based from economic situations that were happening during that time. Which brings it back to our current time. So Singapore is actually one of the 15 Asia Pacific countries hoping to sign the world's biggest free trade agreement by the year end. The country has also just signed its first digital economy partnerships with Chile and New Zealand. Beyond this, the country is also forward-looking in investing in high-impact areas such as health and biometrics, health and biomedical technology, and artificial intelligence among other things. On top of that, Singapore has also maintained the top spot, being the #1 in the annual IMD World Competitive Ranking, so 2 years in a row. So hopefully I ended this presentation in a bit more positive tone, even though we are currently going through this unprecedented health crisis. And I hope you found those insights insightful. Thanks a lot.
Thank you, Alex. It's always good to know and comforting that we always will come back stronger as a country after being tested by different episodes. I'm mindful that we are kind of overrun, but really I think there are some good questions. So I think I'm seeing about 160 plus participants still around. So I will just continue with the Q&A segment, but I won't be actually going through every single one. We'll pick some more relevant, interesting ones. Some answers may be long, so I will then be pointing to the speakers to actually share. Let me quickly go through now, starting from the first speaker. There is a question on, are there limitations of access to medical data that ITIS or any other biotech company face in Singapore? So Dr. Goh has kindly responded that there is a data governance and approval needed from relevant authority that they'll need to adhere to. Dr. Goh, is there anything else that you would like to kind of share on that front, on that particular question?
Right, mainly is that, so actually is privacy, I guess, is a lot of concern as well. So whenever there's a request for healthcare data, there is a governance needed to gain access to that. Yeah.
Okay. The next question is about whether did the ITIS actually assess if this model is as good as a human doctor? So I thought that are common questions in people's mind. So Dr. Goh and Dr. Charlene, can you share your insights?
I go first. Maybe it's not about competition of the AI model with the doctors itself. Actually, I would think that it's assimilating as well as augmenting. So it's actually 2 brains is better than 1. So the AI model is actually help to decision make and complement the doctors in their decision making to make the correct treatment for the patient. Yeah.
Yeah, I actually echo what Han Yong has said. I think a lot of the times we focus too much upon AI replacing human effort or intelligence. Whereas there's actually very strong, robust evidence to show that AI augmenting human intelligence is stronger or more effective than AI or humans operating independently of one another. And you know, it's been published quite widely by various academic centers, including MIT's Computer Science and AI Laboratory, and they've actually, you know, shown time and time again in cybersecurity, in other fields, that, you know, combining AI and human intelligence is actually the way forward.
Thank you, Dr. Charlene. So moving on, I think it's going into Dr. Kamal's space on the product that you mentioned. So there are people who ask, will the cameras be able to detect people wearing transparent masks or face shield?
Yeah, so I think when we started this, we wanted to go away from face recognition, right? It's not that it can't be done, but we assumed you would be wearing a face mask or a shield. So as I was explaining, we look at the overall profile of the person rather than just focusing on the person's face, right? Because we all are unique in terms of our height, our build, how we look. And the beauty of what we're doing is we take the best, what we call as post pictures. So a front picture of the person standing, a back, a left, right. So when you have a picture to match, you can match with whichever works best. So instead of just looking at face, we look at the entire person.
Good. Next question is whether for this particular product that you have showcased, whether there are any current limitations of the WorkSafe and the TrackSafe product?
Yeah, so I think the way we see it is there is no single magic bullet, right? So vision, CCTV provides one way of identifying who has come in contact with whom. Obviously, it only works where there are cameras or cameras can be installed. So in a work location, offices is a nice setting, but if you're looking at completely outdoors, it becomes more challenging. But the advantage is it is passive. So you don't need to wear a band as an example. Where band, every person wears it, you have that. But if people forget to wear it, then it gets lost. So the idea is you can have bands, you can have our product, you can basically build in multiple things to triangulate, because the more you can identify it, the better contact tracing becomes. So that's basically our view.
Okay, thank you. We then now move on to actually questions with Jeff's presentation. Other than credit card spending data, what are other leading or good proxy indicators for the economy? Jeff?
Yes. So other than credit card spending data, as I said, the Google Mobility and Dallas Fed MER as actually are quite good, or I would say one of the most important data that we track, and also some traditional business survey in confidence, let's say confidence in survey sector for the next 3 months. This kind of traditional data are still leading and is quite useful in current situation.
So there is also a question on, since GIC adopts a long-term view of its investments, how does the tracking of COVID data affect its investment decisions? So I will take this question myself. So yes, we are a long-term investor, and in fact, we are a fundamental value investor as well. Right? So to make money, I think general principle, buy low, sell high. Wherever that the securities you're buying, right, buy low, sell high. But at the end of it, when we actually make our investments, there is always a fundamental conviction that we derive based on our analysis. Obviously, COVID with this pandemic, it may actually change the fundamentals. And henceforth, it will allow us to review whether we should stick with certain of our investments or whether we should actually redirect them. In addition, we always want to spend the best bang for the buck, right? So allocations is also very important. So we track COVID in only countries where we have our investments in, so that we can actually know where to actually deploy our funds more efficiently and effectively. So that would be my answer for that. And there's a question also now to Alex. Does Bloomberg track market exuberance as is the current case of the market run-up?
Yeah, definitely. I mean, we've actually seen a lot more data coming out during this specific period. So as what all the panels here have shown, a lot of the data when it comes to, let's say, COVID cases, spending, for example, unemployment, it's become more robust. So Bloomberg has to adapt into this robustness because it has a very big correlation to what's happening in the economy as well.
Thank you, Alex. And actually, for all the other questions that was actually asked, the speakers has actually provided their answers. There's only one last question that was newly posted. So I thought we will kind of have this one last question before we actually end the session. The question is actually towards Dr. Kamal. It actually says that, well, does it really sound efficient to narrow down cases in contact tracing using AI cameras? Will it run a higher risk of false negatives? For example, when the contacts are near each other in restrooms or private areas with no cameras, this would have been excluded.
Yeah, I think that's a great question. Obviously, cameras can't be deployed everywhere, right? So there are areas where it won't work, and that has to be taken in context. So as I was saying earlier, it becomes a part of the toolkit, not the only tool. So that was one. You still need to talk to the person and understand what had happened. Did they come in contact with others? But I think where it does really well is the speed at which it can process video feed where there are cameras. I think on the false negatives, a lot of our focus was to get the accuracy of the detections really high, right? So what we don't want to do is actually miss, as you say, a false negative, miss a contact that actually is there in the camera and you can't see it. And that was why we looked at the whole identifying best post pictures of each individual across the entire day. So you have good matches of who the person is, and then tracking of the person across the day. So you don't lose track of this person in the same camera and between cameras. So you basically, the contact tracing is as good as how well you can identify the person and then track across, right? So that's where we spent a lot of our effort to get it to a, let's say, top one kind of accuracy, about 90%, to make sure that we don't miss any close contact that basically happens, right? So we may err on providing some of those, because there's always a trade-off between false positives and false negatives, as in medical field as well. So we want to err on the side of false positives, but not basically exclude false negatives because the cost is quite high.
Thank you, Dr. Kamal. So I think we have come to the end of the session. I'm very heartened to see that even now we are overrun by 15 minutes. We still have about close to 145 participants online. I hope you have learned from each of the speakers here how they apply AI in their respective areas and the use of different data and analytics to actually tackle the COVID situation together. Right, so thank you very much for attending this session. I hope you find it very meaningful, and have a good weekend. Thank you. Thank you, everyone. Thank you.
Thank you, Chris. Thank you, everyone.
Bye. Bye.